going to be on the left upper quadrant, spleen, kidney, and also the diaphragm spleen interface, obviously. That's where the blood tends to go initially. But anyway, the probe, you can use either the curved array or the phased array, and they both work just fine. I tend to like the phased array because you can get in between the ribs a bit easier than with a big curved linear. You can see here the diagram, the various positions. The thing you want to watch out for is on the left upper quadrant, you have to go more posterior, so the knuckles of your hand should be touching the bed or pretty close to it. And the spleen is not as good at reflecting as the liver is on the right hand side, so you have to manipulate the transducer a little bit more. Make sure you go up and down and get the whole area and get good visualization. And here's what we're looking at. This is inferior towards the feet, and as you move up into the chest, you can see you hit diaphragm, then into the thorax. And of course this is skin, and this is the deeper you go in the body, which in this case you're looking at it sideways, so it's heading towards the other side. This is what a normal left upper quadrant looks like. You can see the liver right here, kidney, and here is the kidney, I'm sorry, the spleen. I know where I am really. The spleen, you can see the spleen-kidney interface right here. And this will fill up with blood last, as I mentioned earlier. This is diaphragm. And here is a normal left upper quadrant EFAST. And you can see this here is the kidney, spleen, and I'll replay it again. This is kidney right here. This is spleen. Let me erase that. And play it once more, maybe. Try to stop it. You can see the diaphragm here, and you can see there's this up here, again, you're heading up, this will be the thorax. And you can see in between the spleen, which is what this is, and the diaphragm that runs up like this, there's no fluid in that area, where you would see it first. And of course there's no fluid here, and that's kidney. And here is another. And you can see there's something going on here. Play it again and try to stop it. So you can see right up here in this area, there's a dark anechoic spot, and that's fluid, blood, whatever. And you can see there's actually quite a bit of fluid. All in here is fluid. You can see the diaphragm was going around here, and see the spleen is kind of almost floating in here. There's quite a bit. And you can see that there's so much in here. Let's see if I can stop it to where you can see. Between the spleen kidney right here, you can see it starting to fill up. And here is another. See that dark anechoic spot up there? That's blood. This is kidney. This is spleen. And they didn't get a real good picture of the superior aspect. They need to move their probe up so they can rule out the area. Although we know there's some there I'd like to see up higher. between the diaphragm and the spleen, I'm sure there's going to be fluid up in here. Let's see if we can spot it at all. I think they have a rib in the way. They need to move up. This is the interface between the kidney and the spleen, but this fluid I'm sure tracks back around there. And another. So this is diaphragm. Oh, here's kidney. This is spleen. You see this patch of fluid right there. Let me play this again. Let me stop it. So this is diaphragm coming down here. And you can see the dark fluid anechoic in there. Let me get this going again. Right in here. That's fluid. And I would like to go up a little higher and see if there's, because that's not a very good mirror image there. You should get a mirror image of the spleen to see if there's any fluid up in the thorax. Here's a better one. Here's kidney, spleen, and you can see this dark anechoic space all up in here. That's all fluid. And you don't see much here. But this is diaphragm here. You can see on this side, this patient also has pleural fluid. This is all in the chest cavity. So he's got a double whammy going on. So he has a hemothorax and a hemoperitoneum. I'm sure he's a trauma. Sometimes if you have difficulty seeing, if the patient's able, you can have them take a deep breath, and that'll move the diaphragm up. And what you weren't seeing before, there might be fluid there that you weren't seeing, and with that deep breath, the diaphragm moving away from the spleen, suddenly you can see this fluid in between here. So that's a little trick that helps, again, if the patient's able to, or if they're able to cooperate. And here's a still image. This is spleen here. And this is the diaphragm coming up this way. And you can see the fluid, this dark anechoic area here is fluid. And of course, this is the probe in the more superior position. And you can see that you have a pretty good mirror image here of the spleen, so there's nothing over there. And this is some spine down here showing up. And another still image. This is kidney. And of course, this is your spleen. This is diaphragm. You have a good mirror image in here of the spleen, so you know that's not fluid. And you can't really see, you need to go a little more superior to see more of this. But what I see here is a clot right here. That's blood clot. You can see the difference. And this is a little bit of anechoic space here, so that's some fluid there as well. So this patient had a bleed and has formed a clot there. Sorry about that. That was my lovely wife. She has radar, and she always knows when to call when I'm doing a podcast. So anyway, back to this. This is kidney, of course, and spleen. This is a clot. All this area here is a blood clot. And you can see how it is different a little bit from the spleen. And you can still see a little bit of black anechoic fluid here and coming down into this area. So this patient has a pretty good bleed going on. And I would also want to check his pleural area just to see. Looks like some spines showing up. Could be a little bit of a spine sign. But in any case, And here's another still. You can see the kidney right here. Right here you see a black anechoic area. That's going to be blood or fluid. And this is spleen. This is diaphragm. You see a good mirror image here. Nothing going on there. There's some spine. So this is a positive fast. And that's the last slide. I hope this helps. Um, it's a little more difficult, I think anyway, doing the left and the right, just from the positioning and less of an acoustic window with the spleen versus the liver. And this will be the last part before we hit the heart. Hope you all enjoyed it, and if you like it, please like and subscribe. And I just want to put in a quick plug for this company. It's Twin Oaks. They give outstanding um, critical care and point of care ultrasound courses. I've taken this one so I can speak from firsthand experience. They have one coming up in Tampa, October 26th and 27th. The next slide. And here's the website. So come join us October 26th, 27th in sunny Tampa.